Now I invite Dr. Sukhpreet Patel. She would be the moderator for the next panel, Healthful Body. She is the director of the Vita Fertility Clinic, Mumbai, and she is also a research. She is also associated with Nauroji Vadia Maternity Hospital, and she's a fertility consultant and unit in charge. And she is the founder of the and fertility consultant at the PCOS Stop, and founder and proprietor of the multi-speciality clinic for PCOS patients. And she's also associated with NIRRH. I request Dr. Sukhpreet to introduce her panel members.
Thank you, Dr. Patel. Good evening, everyone, and welcome to the Healthy Body workshop. Our panelists today, we have Dr. Aashish, Contractor. He is the Director of the Rehabilitation and Sports Medicine at the Sir H.N. Reliance Hospital. He is also the former Director of the Mumbai Marathon and incidentally has run the virtual Delhi Half Marathon just this morning at quite a phenomenal pace. We also have Dr. Purnendu Nath, or Puru the Guru as he is known. Can we change the slide, please, to the next one? Even though his PhD is in finance, he is a wellness mentor to patients, including those with PCOS and medical professionals across the globe. And he works primarily through lifestyle modification. Dr. Tejal Kanwar is a gynecologist and an entrepreneur. She is the co-founder of Kleinetics, pioneering in kids fitness space. And we have Dr. Ulka Nathu, who besides being a gynecologist is a yoga lover and passionate about the heritage of yogic science. She is also a practitioner of yoga and loves to incorporate yoga as therapy for her patients. So getting started with our discussion today, we will be describing a few case scenarios of PCOS, and our panelists will provide us with practical guidelines that we can follow while prescribing exercise to our patients. So starting with the first case, we have a 15-year-old who achieved menarche just over a year ago, and her cycles have been erratic since they started. Her BMI is 27, but she experiences no hirsutism or acne. Ulka, starting with you.
Yeah.
As a gynecologist, we usually reassure girls and the mothers when they have irregular cycles, especially in the first couple of years post menarche.
Yeah. Yeah.
But in this girl, would you worry about her period irregularity?
Yeah, definitely. That's because of her BMI. Because I understand in initial 2-3 years, one would never intervene with the natural cycles. And we would not give her oral pills or anything. But it's just because of her BMI, I would make her, cautious about what is happening in her body and what she is leading to, because maintaining the weight is very, very important at this stage in her life. Second thing is good lifestyle habits need to be incorporated in her, and this is the right time when we can catch hold of her and counsel her about the same. Third is they have to take out the time for the fitness activities, and if you ask the girl of this age, to start off with her physical workout or yogasanas for that matter, they will always have his initial hesitation, because if nobody likes to trouble the body, this requires concentrated and dedicated efforts from their side, and they don't like to trouble their body. So they need to be convinced about what would happen, if she lands up with PCOD, and then that.
So it is the right time. It's the right time to target her and counsel her,
yes,
right?
Yes.
Tejal, coming over to you. Schoolgirls usually have access to various kinds of sports today in-house, so they don't really need to go out looking for it. And even though there is talk about a competitive advantage for sports due to hyperandrogenism and PCOS, most of the girls shy away from exercise. They don't really participate in it because they're conscious of their weight, and that is, in fact, they need it more and they tend to get it less. How and what kind of exercises do you recommend for this group?
Actually, it's world over. The girls are always working out less than the boys. And boys tend to get more outdoors and more workouts. And adolescent girls are, so we have a double problem right now. So between the age of 7 to say 18, the exercises which the girls really enjoy is dancing, anything music related, and a lot of aerobic exercises. But after puberty, I would definitely recommend twice a week of anaerobic, say a little bit of weight training as well as resistance training and interval training. That really helps in muscular strength building. And apart from the high BMI in the case that we were talking about, I think the waist circumference and a lot of other body composition issues should be also taken into consideration. So a mix of aerobic and anaerobic twice a week would be great, and a proper workout plan would be really good. They need to play sports. uh, there are kids who are interested in football, and there are girls who are doing really well with swimming, but we need to inculcate more from starting from schools. So what parents and schools need to do, they are the gatekeepers for a fitter lifestyle for the children. And schools, besides the academic literacy, they need to focus on the physical literacy aspects as well. So that's where it all begins.
Right, right. Okay, so Ulka, coming back to you again, how accepting our children of yoga, considering they sometimes classify it as being for oldies, is that a block that you can help get over?
Definitely. No, it's the same wine, but it has to be given in a different format, in a different glass altogether. And our experience is children accept yoga beautifully. Like we have conducted batches for children, especially for increasing the concentration in studies, for improving the memory, for increasing the height. And thousands and thousands of children, our organization, me also personally, we have dealt with. But the thing is, children are the most susceptible group, I would say, because whatever you try to give them in a positive way, they try to accept it in a better way. In fact, they are the better yoga practitioners than even the adults, and they practice it with utmost sincerity, commitment, and seriousness. So the practicing of a lot of yogasanas, you can give them yogic games, you can give them animal asanas, you can give them alphabet asanas, you can give them surya namaskar, you can give them pranayam, you can give them mantra in form of chanting. What is mantra? Mantra is focusing, mananat trayate, that is, that would help them focus on to whatever they are doing in their life more positively. So I feel, I would give you one example. In government of France has introduced yoga in every school officially, by Bihar School of Yoga. North America has volumes written on yoga for children. Now, if abroad they can do it, why not in India, which is, we are the root of yogic science. And I think it
Absolutely.
is high time we start implementing compulsory yogic practices in school. That will not only give them the physical stamina, but mental clarity, creativity, and peace of mind, which is what is the, the youth of today
Right,
needs very badly
right,
in this
right.
age of
Right.
technology.
Purnendu, what could one say about education and career to a girl of this age to motivate her to be physically active? Like she needs to see something beyond just her weight right now. How does one motivate a girl at this age?
I think that's a great question, because one of the things that we have to realize is that the typical problem that someone has at that age is that they're short term. They're thinking about the next week's test and that year's exam, and maybe trying to get to college the next year. But the problem that they have, that we see, for example, the symptoms that we describe, are actually an underlying problem that is going to affect them for the rest of their life. And the thing that they're going to have for many years going ahead is their work, right? And that's going to be a different space. So it's great that you are asking about something that's long term. And I think the big thing to probably therefore get into their heads is that, so firstly, if you look at this very specific case, we talked about someone with a very high BMI. And this is something that they kind of see negative as, a sort of negative self-perception. And I think the first thing that we need to do, because the other two ladies mentioned that we need to get them to do things and maybe they'll accept it. The question is, how do you get them to do it? And I think if you always start focusing on what's great about what this girl is doing. So for example, in this specific case, just to point out, like, hey, you know what? You don't have acne. You don't have hirsutism. Do you know how lucky you are? But you still have a problem. So take that as a good starting point and tell them that there's stuff happening inside you that is going well, but there's stuff that's not going well. So if you don't get this thing sorted out now, it might affect you later. So that's one part. The other part is just, there's this whole idea of what can you control and what can you not control. So give them the simple idea that, look, you can study and you can get good results. When you start work, it may be that you work really hard, but you can't control what your boss does for you in terms of a promotion or a pay rise. So the thing to do is focus on what you can do for yourself at this stage onwards, and therefore give them, and every child understands this idea of compound interest, right? Just tell them, make a small change. Just teach them this idea for 1%, right? Every day do just 1%, and over time you'll make a big difference. So I think putting all of that together, short-term education results, long-term work, and this 1% thing, and I think they'll get ahead.
Tejal, how do you deal with, kids are so burdened with classes and tuitions and boredom? Oh, this is so boring and I don't have the time. How do you manage to deal with that with children?
So yeah, so one thing is people always complain about there's lack of time. So there's no such thing as lack of time. There's just excuses. So I think that is very important to educate the parents, the schools, as well as don't keep complaining about that. Exercise is non-negotiable. It's like you brush your teeth, you go for your bath, you do your daily reading. You need to work out, you need to exercise, and that is the bottom line. And if the schedule in the school is a problem, leave the school, change the school.
No, that's not always practical. But exercise-wise, do you have any tips that they can use?
Reducing the children activities, we've overburdened the kids with a lot of activities. I think we need to audit the time of our children. The children also should be given the power to audit their own time. So that is one thing. Instant gratification, yes, it's definitely a trap. A bowl of ice cream compared to a round of cycling, yeah, there is definitely a huge challenge nowadays, and we need to be mindful of that. And as doctors, when the child and the parent is coming to our clinics, we need to educate them, create more and more such workshops, so that we can go back and not just say, okay, go take a walk, or just cycle around. You need to create that awareness of getting serious about their change in lifestyle. I think that is very, very important to drive it down. And coming to boring workouts, or getting motivated in different types of workouts, so analyze what is boring the child. Is it the trainer? Is it the workout? Do we need variations in the workout? Do we need varieties of different disciplines of workout? So that, and a child always enjoys a group workout. Okay, it's not going to be easy for a child to have an individual. It's a little boring. Gamify, funify, storyfy the workouts. Children really love gamification. They love to score. They like rewards, and that is also gratifying. Maybe a little delayed gratification, but definitely there be positive signs of motivation. So that will really help.
Right. Thank you. Thanks, Tejal.
Yeah.
So we'll move to the second case. We have a 19-year-old medical student who has PCOS. She has acne, hirsutism, irregular cycles, the works, and but fortunately her BMI is 21. Tejal, would you recommend exercise for lean PCOS as well?
Yes, definitely.
All right. And Ulka, when this BMI is normal, there is no obvious need for weight loss, but can yoga help her cycle regularity and her cosmetic problems?
Yeah, certainly, because it is in fact this place where yoga would have tremendous role to play. Because what we are dealing with in medical student, especially what you mentioned, is the stress, the level of stress what the girl is going through, the improper lifestyle, sleeping late, maybe getting up early, inadequate sleep pattern, then improper dietary habits, probably no time to eat properly. And then the fourth and the most important, which Tejal agreed, is lack of exercise in these girls, and she would definitely give them exercise. So now what happens is, we all know very well that it is this stress which is going to disturb the HPA as well as the HPO axis, And now it will also, it is proved beyond doubt that it brings about the stereochemical changes in the membrane receptors, which leads to the genesis of insulin resistance. Now, this stress is also going to lead to thyroid disturbances. And there was a study conducted at Sion Hospital, Lokmanya Tilak Medical College, among the girls, medical students, as to how much of stress and the secretion or the excretion of the norepinephrine, epinephrine, whatever, and the serum cortisol levels, etc., etc. I am not going into the details. The point is the yogic practices were given to them, and this study is published. How useful it was to them. Yeah, for that matter, we also started training medicos, second MBBS girls at Kalwa Medical College and at KEM also, and with very encouraging results. But because of lot of reasons, we had to discontinue, but the work is still going on. But now we know All India Institute of Medical Sciences, NIMHANS, then the Medical College in Pondicherry, they all have incorporated yoga as part of the training program in second MBBS, along with your preventive social medicine, forensic medicine, and whatever. So
Right.
yoga will not only help PCOS, but other problems like,
Right.
related to better focusing of study, etc., etc.
Right.
It would help them. Yeah.
Ashish, now considering fat loss is not a goal for this girl, what kind of exercises would really benefit her? What should she be actively participating in?
Thanks, Sukhpreet. So before I start, let me just thank the PCOS Society and you and Dr. Priya for inviting me and putting together this excellent panel. I learned a new word today. Tejal taught me funify. I'm going to funify exercise. So that's good stuff. I think the point of fat loss and weight loss and muscle gain and all is going into nuances. And what tends to happen is people, come to their doctor and they get lost in these nuances rather than look at the bigger picture. So if you'll give me a minute, I'll just talk about the WHO guidelines for physical activity for 20, literally released like 3 days ago. So I think it's relevant to talk about it. They say that every individual should try and get about 150 to 300 minutes of moderate intensity physical activity in a week. Okay, so that's roughly anywhere from 40, 50 minutes a day. And moderate intensity is defined as less than 6 METs. 6 METs is metabolic equivalent. So that's like walking 1 kilometer in about 10 minutes. Okay, so try and get 150 to 300 minutes of that. Or you can try and get 75 to 150 minutes of vigorous intensity. Stuff like running, playing tennis, playing a game of squash, things like that. Include strength training as part of your program, and also include 60 minutes of playtime, fun time, bone loading exercises for children. Funify it and make sure that they do it. Okay. So getting back to your exact question, just because whether fat loss is a goal or not, I think she should have 3 to 4 days of cardiovascular type exercise, walking, running, cycling, swimming, and at least 2 days, maybe even 3 days of strength training. Okay, and we can talk about what strength training later. Just one quick point I want to make, and I'm sure you face that a lot, both personally and in your practice. I think Indians have this tendency that if they see someone who's 21 years old, 21 BMI, the family and everybody around is lecturing them on how thin they are, and they want to put on weight. So I think that's the first thing the doctor, the gynecologist needs to counsel probably the family, that someone is BMI 21. It's a healthy weight. So they don't need to try and put on weight. Okay, so I don't think we need, as they're being physically active, that's good enough.
Right. Thank you, Ashish. Purnendu, there are a lot of variables in the market today that monitor from the number of steps you take to your oxygen saturation and your sleep patterns. Are these variables like a good investment for someone who doesn't have dedicated time for exercise? Are they going to give them enough feedback for them to, what are studies saying about it?
So if you look at long-term compliance with using these wearables, it's quite low. And of course, that's sort of looking at large numbers of people, and when people typically will buy it, use it, get excited, make some changes, but over time will not use it. And this has been seen in terms of recent studies that have been out, because wearables haven't been out for the mass public for very long. but this is something that has come about. The great thing is on the flip side, you get wearables for all kinds of things. So now you can buy pretty affordable wearables that will tell you your number of breaths per minute, your heart rate variability, and even do an ECG. The question is, even though you have this, how is it going to help you? And in this very specific case, you've got someone who's busy, right? Whether it's actually medical school or IIT engineering school, or even someone who's doing a BCom and training to be an accountant, they don't have time, like you said. So what is it that you're going to get from this wearable? And I think what's great is that someone who's busy can still notice that they're being active, or on the days when they're suddenly not active because, you know what, they've got a break for studies, like 2-week break. And then suddenly realize, hang on, I'm not walking around much. I'm eating more junk food. And maybe I know that I've just done 1,000 steps today instead of my usual 15,000. I think in that sense, it's really good. Because in the big scheme of things, whether you're looking at the medical student, an engineer, or an accountant, it's going to come down to numbers. And in fact, even in this medical student, whether they're taught healthcare technologies in college or not, it is the way forward. So if they don't get used to it now, they're not going to be able to help, never mind themselves, but even their patients, right? So I think this is something that's really good. And it also comes down to developing that internal culture for that person, for them to say, look, just getting the data is of no use. Aashish runs, I run, we all wear garments, but how many people analyze the data that like we do, right? So I think that's very important, to analyze the data, not just collect it.
Right. Thank you. Aashish, the same girl, if you say her BMI was say 27, would her exercise set change? Or would there be a different set of recommendations for her?
Not in a big way. The only difference is that if her BMI is 27, I mean, she's clearly in the overweight category or obese, depending on which cutoff you want to use. I think then you would like to have longer duration exercise, maybe not that high intensity, just try and increase the duration overall. So she just gets a lot more calorie burning. What tends to happen is today, this high intensity exercise has also become a bit of a fad. And while that definitely has its benefits, the adherence rate tends to drop because when they do very high intensity, sometimes they also tend to get more injuries and they stick to it less often. So I think if they had a lower intensity, longer duration would probably help more from a weight loss perspective. And obviously from weight loss, diet plays a huge role, which I'm sure has been discussed earlier as well.
Right. Thanks. Purnendu, when would you say is the best time for exercise when one wants to lose fat and weight? Is there a particular time that works best as far as the circadian rhythm goes, or your state of fasting? When is it most effective in your experience?
So I think, so that's a great question because I think one of the things that we tend not to do is to place the dimension of time along with everything else that we do. We just tend to go with sort of what seems to make sense without justification. So here, if you look at the science, we'll find one result, but then there's also the practical living. So we've known for 40 years that an apple eaten in the morning versus eaten at night will have a different impact in terms of insulin response and things like that. So I can tell you that if you want to exercise, the simple thing is to do a lot of exercise closer to the time when your glycogen stores are low, because that's when you're going to burn more fat, right? So if your carb tank is, and this is an important thing, I think most people don't quite realize, like I've come across professionals who don't realize that your carb tank has only limited capacity. Even marathoners don't quite understand it. So I think for people to understand that what they want to do is empty out their carb tank and then continue to exercise there to get real kicker from the exercise in terms of fat burn. I think that would be really good. So, and coming back to this case of the skinny girl, right? She's skinny, even though she's kind of not exercising much. And typically you might find is that they're snacking through the day. So they're constantly getting this insulin spike constantly through the day, not enough to put on a lot of weight, but it's definitely causing problems with, having too much insulin floating around. And it may not hit them now, but it's going to hit them even more later. So.
Right. Thanks. Tejal, how are you dealing with this lean PCOS? As you said, it was important for them, but is there a different gamify, funify for them, or are they in the same sort of batch group as the other overweight patients?
Yeah, so lean PCOS, again, coming back to measuring the fat distribution. would help, and even the waist circumference. And actually, if you measure insulin, we need to know uh, the fat distribution, because that's how we can plan the workouts. If it is just a thin girl without PCOS, that is separate, and lean PCOS, we have definitely hormonal issues here. So we need to address those issues. And weight training, as Aashish also mentioned, would definitely help, specifically in this case, because that will help develop the muscles, as well as pushing the insulin, driving it into the muscles. So that will be a specifically, we need to target that more than aerobic and more than cardio.
Thanks, Tejal. Moving on to the next case, we have a 28-year-old PCOS lady who's trying to get pregnant. Her BMI is 25 and she's been advised weight loss by her fertility consultant before she attempts any treatment cycle. Aashish, coming to you, couples are usually a bit anxious about exercise while they're trying to get pregnant, and they in fact argue and debate and say, oh my God, I shouldn't be exercising right now. You're asking me to lose weight. Is that going to harm me? Is there any exercise that you would not recommend to someone who's trying to get pregnant?
Sukhpreet, from whatever I am aware of, the literature I've read, I've not come across any exercise which someone should not do when they're trying to conceive. If at all, on the other hand, people who are not exercising regularly, exercise might even help them conceive, might help their PCOS a bit better. Now, it's different when someone's undergoing fertility treatment and their cycles are going on. From there, of course, you're the expert, and I'll let you sort of talk more about that. But I believe that once the cycles are on, then certain high intensity exercises are avoided, but you might still tell someone to do something moderate like a brisk walk, but you may avoid high intensity exercise, impact type exercises, which may, I guess, dislodge the embryo, but not while they're trying to conceive in a natural way. That shouldn't matter.
Right, thanks. I guess the guideline is usually don't start anything new while whatever you're used to, you just continue doing that. Yeah. Ulka, is it okay to perform yoga during treatment cycles? Like when someone has an IUI or an embryo transfer, can they continue with the same yoga, or do you modify it according to their cycles?
Yeah, I would clarify one thing. Yoga is not only the physical exercise. It encompasses a lot of aspects which need to be, looked at. Like, like you have the mental state, which is more important. So if at all you are doing the pranayam, it is not for doing the breathing exercise. It is controlling the mind, which we are trying to achieve by doing pranayam. So then emotional practices, they are to channelize your emotions in a more positive way. Then you have spiritual practices like meditation, or you have pratyahara dharana. So these practices, they do not focus only on the physical aspect. Asanas also, if you are performing, they are not only for the physical gain. Of course, physical gain is one of the aspect of it, but having a mental quietude or emotional tranquility is expected out of performing any yogic practice. So if at all, a woman is undergoing the treatment for fertility, say for example, and we recommend the practices, and we have a beautiful study which is published, and there we have definitely advised them to, the anxiety score reduces, the depression or that score reduces to a great extent, the acceptance of situation increases, then the number of follicles, the rupture of follicles, the endometrial thickness, the perifollicular flow, what we are looking at, the vascularity of endometrium, all these factors which we look at while they are performing the yogic practices under treatment cycles. So all this we see a significant improvement, and this is because your HPO axis and the central nervous system, everything is geared up when you are performing the yogic practices. So I would just put it in simple words: if you can't make it through one door, I will go through another door, or I will make a door, and certainly something will come out of it, no matter
hopefully
how.
it will be a baby.
Yeah, hopefully.
All right. Purnendu, motivation is usually the biggest challenge when it comes to exercise. To put yourself through pain, as Ulka said, is a tough one. And how do you motivate your mentees and sort of police them to reach their goal? Because it's not only about starting off, it's about staying on track for a long period of time.
Good question, because I think, when someone first comes to you for help, they're happy to do stuff. That's why they've come. They want to do stuff. So they start up doing stuff. And sometimes they get results soon, or sometimes they don't, or they get results and then they're complacent. So the question is, how do you have compliance? And what I've seen is actually whether it's male, female, PCOS or not, and no matter what their background, it just so happens that this accountability is a big thing. So having an accountability partner, if you like, ends up being an important part of people's compliance. So I'm able to keep track of people around the world, all kinds of backgrounds in terms of what they're doing, and it's often without them having to necessarily update me. So I've built things and infrastructure for me to be able to keep track of what they're doing. So I think that's great because everyone's really busy, right? And the question is, how do you prod them and nag them, if you like, at a time when they're going past the tipping point and they might go down down a slippery slope. So I think it works both ways to be able to monitor and stop them going down the wrong path. And plus, when they do actively need that motivation. So yeah. I think besides the wearables, if the wearables are connected to a system where you can keep track of what they're doing, that would be really good. And I think that really helps this accountability.
I guess technology has a big role to play in all of this, right? Yeah. So Aashish, talking about motivation, during the lockdown, we've seen like two sets of extremes: those who've emerged with six packs, and then the others who've completely ballooned out. And excuses for not exercising include those of not wearing masks. And what are the recommendations for wearing masks during exercise during this COVID pandemic?
Sorry, Sukhpreet, I missed the first part of your question, but if I understood correctly, you're talking about masks and exercise, right?
That's correct.
Okay, so this is a very interesting kind of topic, and people have been, going back and forth, and it's also frankly quite controversial. So I'll just keep, the guidelines very simple. When you are going out of your house to exercise, make sure you have your mask on. All right, just make sure you have it on you. Now comes the second part. If you're doing moderate exercise, such as, like I said, walking briskly, I think it should be okay to walk with your mask on. It's not really that hard. People say they feel uncomfortable. Once they get used to it, it's fine. You heard these horror stories of carbon dioxide retention, and like most things on WhatsApp, that's all nonsense. None of that has happened. There haven't been any documented cases of people suffering ill effects of exercising with masks on. And in fact, now they show you could even do that with higher intensity. Okay, so if you're doing moderate intensity, keep the mask on. If you are doing a higher intensity exercise, like running, when you're out on the road running, you can lower the mask. That's what I call it. So keep it on, but lower it. As long as you can maintain distance between people on sort of either side of you, that's fine. If you get into a zone where you're not able to maintain that distance for that short stretch of time, raise your mask again. The bottom line is that the risk of transmission automatically drops a lot when you're in the outdoors. So when you're in the outdoors doing higher intensity, if you lower it temporarily, it's fine. But when you're unable to maintain distance, then put it back on. I think that's the simple take-home message.
Thanks. Purnendu, how does one deal with injuries? We see not the injury per se, but what happens during the injury to someone who's exercising to lose weight, and now they were walking, now their knee hurts and they can't exercise anymore. And so now you go back to square one, the person tends to again put on weight. There are many alternatives to, of course, exercise, but how does one keep on track despite the injury?
So I guess there's two parts. So if you're thinking about exercise for a purpose, and one of the purposes being just maintaining appropriate sort of body composition or total mass or keeping fat down, then clearly if exercise volume reduces significantly, then one of the things you have to do is make sure that your fuel intake is adjusted, right? We're not supposed to eat for entertainment only. We're supposed to eat for fuel. So that's one of the first things to sort of remind people that, hey, you know what? You can't run, so go easy on the sort of calorific foods, especially the low nutrient density foods. So I think that's one important thing. But when it comes to exercise otherwise, So for instance, if they can still walk, then that's again where your question about wearables helps, right? So I remember during the lockdown, I was in Dubai, stuck there for 100 days, and I never ever counted my steps. But suddenly not being able to go anywhere for 3 weeks, I started using the step counter. And I found that that's really helpful for a lot of people because sometimes they can't work out for 2 or 3 days because they're at a conference or they're busy with something. Then just keeping track of that is good. Now, if they've got injured, I think the key thing is don't let the acute thing become chronic. So if someone's excited, they're paranoid, they're not exercising, then that's the first thing to tell them is that, look, it's better to rest for a whole week and then get back properly. And then when you get back, you have to start off easy again. People typically tend to go back at the level they were at earlier, and that's not good. And of course, while they're injured, there may be other things they can do. For instance, they might be able to swim, they might be able to cycle and still not have pain and things. So it's just a question of the details, right? If someone's really badly injured, then of course exercise is completely out, but then they should watch their food. One of the things that I tell people is, you know what, when you get injured and you have pain and you can't do stuff, one of the best things to do actually is to somehow exercise some other part of your body to develop natural painkillers. So I do that all the time. If I've injured my foot because of some crazy reason, I might go to the gym and lift weights. And I know that when I come out of the gym, I can't feel the pain in my feet simply because I've produced endocannabinoids. And I think that really helps.
Thank you. We'll move on to the next case now. We have a 30-year-old who had PCOS prior to pregnancy and now has gestational diabetes. She's at 28 weeks and is currently on insulin. Aashish, what are the recommendations for exercise in gestational diabetes, or especially now considering she's pregnant and she's got diabetes?
Yeah, sure. So Sukhpreet, basically exercise, they say, has an insulin-like effect. Okay, that's a nice sort of way of putting it. And I'll give you 3 or 4 practical points. Because it has an insulin-like effect, when you exercise, your sugar tends to drop. And the beauty of the body is that even if you do moderate exercise, okay, so we see patients, say 10 minutes walking on a treadmill, 15 minutes on a bike, and they start with a sugar of say 190, 200, and it drops to 120, 130. So sugar tends to drop. So the first few times when they're exercising, especially those patients on insulin, check their sugar before and after. So you kind of gauge what their response is. Based on the response, you might need to alter the dose of insulin. Okay, that's one thing to keep in mind. Second thing to keep in mind is keep a carbohydrate snack ready, like a sugar sachet, a chocolate, a sweet, something ready. Because if the person goes into hypoglycemia, okay, they're sort of sweating, they're feeling lightheaded, the typical symptoms of hypoglycemia, you can give them the snack. When they're exercising, avoid injecting insulin in the muscle that's going to be exercised. So, for example, the commonest sites that you'd give someone insulin would be the thighs, would be the abdomen, or would be the arm. So if they are going out for a long walk or a run and they normally take it in the thigh, avoid giving it in the thigh before exercise, because what's going to happen is when you're exercising, blood flow through the thigh muscles or leg muscles is going to increase tremendously, which is going to circulate the insulin even quicker. Plus exercise will cause sugar to drop. So you get the double whammy effect and it may drop too much. So you might need to change the site of injection. The last point is avoid exercising very late in the evening or night because of this hypoglycemic effect. So the hypoglycemic effect may hit 2 hours later. If the person's awake, obviously they feel the signs and symptoms and they'll take a snack or they take some sugar. If they're sleeping, they're going to get hypoglycemia while sleeping and they don't realize it, and obviously that's a bad thing. And the last point is if someone's on insulin and they've also maybe having other complications like retinopathy, for example, it's not that common, of course, but then avoid very high impact exercises. And sorry, one more, check their feet regularly for ulcers. Because people with diabetes tend to have small injuries. If they're doing a lot of exercise, they may hurt their toes or their foot, which they don't realize thanks to the neuropathy. And that little ulcer becomes bigger and bigger, and all the negative consequences then take place.
Yeah. Aashish, what about our patients on metformin who have been put on, they've been asked to lose weight and they've been prescribed metformin, and let's say they're not pregnant, like if they've just been prescribed metformin, and how is the relation?
So, I think that should be fine. Honestly, metformin doesn't have that same sort of effect like an insulin shot would have. And the same thing, we maybe once in a while check their sugar before and after exercise. And metformin works quite well with exercise. Sometimes people are very worried about hypoglycemia, but you tend to feel it. So, the person can pick it up and just, keep a snack ready and take it. I've rarely come across, I probably have seen 20,000, readings of people before and after exercise with diabetes, and rarely has the, number dropped so much that, simple sugar snack won't take care of it. So I wouldn't be overly concerned if somebody's on metformin and they're exercising.
Thank you. Ulka, patients with gestational diabetes sometimes present with polyhydramnios, and they've been asked to take bed rest, sometimes even head low. And, at one end, they need to exercise to control their sugars, and the other extreme, they've been asked to take bed rest. Are there any yoga asanas that they can perform in that bed rest position?
Definitely. As I mentioned earlier, yoga is not all about the physical practices. Yoga is also about practicing, besides the physical aspect, you have the mental aspect, emotional aspect, spiritual aspect, the diet, the counseling, and the congenial atmosphere at home. Everything contributes to the good outcome of it. So the physical practices, the asanas, you can practice a few mudras. Say, for example, loosening practices you can do. Then lying down position, you can do Uttana Tadasana. You can do Bhadrasana, Uttana Bhadrasana, lying down position. You can have left lateral position, that is Vamangasana, Anantasana. There are innumerable asanas which I can mention, but I'm just saving time. For the mental practices, you have the practice of pranayam, that is prana sadhana. You can perform deep breathing exercises. You can perform Nadi Shodhan, Shitali, Sitkari, Pranayam, Brahmari. See, all this is going to accept the situation in a more positive way for a positive outcome of pregnancy. Now, besides that, emotional practices would include Omkar chanting, listening to few satsangas, Yoga Nidra, that is guided relaxation, which is going to have immense value when you are practicing all this. Then the practice of meditation, the practice of Antarmaun, practice of japa jap, these are all the categories under which you can train the patient, or you can train the pregnant lady, and the outcome is going to be beautiful. And of course, the emotional catharsis has to be done, and that could be done with the help of counseling sessions, satsangas, whatever. So it is, this integrated approach of yoga therapy, which is what is going to help this woman even in lying down position.
Right. Yeah, right. We're aware that stress automatically will reduce her cortisol and help her diabetes.
Yes.
Sure. Moving on to the next case, we have a 54-year-old menopausal woman, and she was diagnosed with PCOS during her reproductive age years, and now she has a BMI of 25. She has metabolic syndrome, dyslipidemia, borderline high blood sugars, and glycosylated hemoglobin. Purnendu, women usually shy away from strength training and lifting weights. They think it's more of a macho man thing. What is the role of strength training for PCOS women in this age category, postmenopausal?
So I guess it's not so much a question of the role for strength training, because we know it's important. The question is, how do you convince her, right? And I think, again, like I said, it's all about the long term. 54 is still actually quite young, may not be reproductive, and nature doesn't care whether we live or die soon after our reproductive years, right? From an evolutionary perspective, it doesn't, we're not built to necessarily last for very long beyond it. But the key thing is, how do you convince a lady who's 54 that she needs to develop muscles? And the key thing to tell to her is that it's not just about men. So that's the first thing to get across, because they keep thinking it's about them. And then to explain this whole idea that you need to do it because your insulin sensitivity will improve. You need to increase your carb tank by a little bit, etc. And that over the longer term, it's not just about muscle strength, but also about control and reaction speed and coordination, balance, and all of those things. And to actually just make it really clear to them, ask them, when you go on holiday, don't you notice that it's mostly the flights coming out of India that have wheelchairs at the airports in London and Paris and places like that? And other passengers are going around without wheelchairs. It's only in the Indian flights. So I think, given that we're in India, I think that's a really key thing to get across to them. that it's not just about this, you're not going to become a muscle woman. You're doing this because over the longer term, you need to be able to do your activities of daily living, to be able to take your shopping, to go on holiday, to not need a porter wherever you go. And the key thing, which is typically women are worried about, is bone strength. They're worried about osteoporosis and breaking stuff, right? That happens because their coordination balance isn't right, and that they don't do strength training to strengthen their bones. And it's definitely nothing to do with drinking milk, right? So I think that's the key thing.
Thanks. Aashish, considering that patients with metabolic syndrome are at high risk for cardiac events, they are also the group of patients who are in need for exercise. What are the guidelines that we can follow while prescribing cardio workouts to these patients?
Okay, so I just want to quickly sort of reiterate the 2 points that Puru made about strength training being important in women and how Indian women tend to not move so much, and we should encourage them to move more. So I completely agree with it. And I agree with his observations at the airports as well. I think the message we need to give everybody, if we need to take home one thing from this session, is move more. Okay, there's just 2 very simple words. In terms of cardio exercise and metabolic risk, so typically this insulin resistance syndrome or metabolic syndrome, right? They have a low HDL, high triglycerides, borderline blood pressure, borderline sugars, obesity around the stomach, the abdomen. That all puts them at risk for cardiovascular disease. And exercise has a positive benefit, frankly, on all of these things. So we, in fact, call it exercise as medicine. And if we look at it as a medicine, we need to have a prescription for it. And the prescription, you can look at the FIT principle. An easy acronym to remember is FITT. F stands for frequency. How often should you exercise? Try and be active every day. Formal exercise should be at least minimum 3 to 4 days a week, but be active every day. Intensity is how hard do you do it? Just start at an easy pace. We can get into technical guidelines like heart rate monitoring, which we don't need to, but just to get started, it should be at a moderate pace, which means it's not so easy that you feel like you're just sort of strolling in the park and looking at the flowers, but it's not that hard that you can't carry on a conversation with somebody next to you. So it should be a moderate pace. The third letter is T for time. Ideally 30 to 60 minutes, but honestly, something is better than nothing. 5 minutes is better than 0, and 10 minutes is better than 5. Okay, so once again, just move more. And the last T is for type of exercise, which, as we've discussed in this panel, 2 large sort of categories. One is the aerobic exercise, running, cycling, walking, swimming, etc. And 2 is the strength training. So your prescription should be this sort of FIT principle. And a lot of people are concerned about this too much exercise. Let me sort of say it very, very clearly. It's very, very difficult to really get into this concept of too much exercise. Those are people who are doing more than 100, 150 kilometers of running and such exercises week after week, which honestly form a very, very, very slim minority of the patients you might see. So just move more is the simplest guideline I can say.
Perfect, great. Ulka, as you mentioned earlier, there was a lot of spirituality and other meditative practices in yoga, and yoga is very often associated with these as meditative practices. How can yoga help? Can it help this metabolic syndrome and significant weight loss? Because we look at it as very passive exercises as opposed to allowing them to burn calories and lose weight.
No, it's a wrong concept that it's a passive exercise. In fact, it's the most active form of mental exercise. We have a publication in NIJRM where we have put it as a part of research that beta cell functioning improves after yogic practices, which I feel is a great achievement. You can give a prescription. I call it a yoga capsule. What would this yoga capsule comprise of? It would be 3 mantras, which are Gayatri mantra, Trambakam Yajamahe, that is Mahamrutyunjay mantra, and 32 names of Devi. You can chant anything, whatever. But this is what is advocated by Bihar School of Yoga, which is my parent institute. Then you can have 3 to 5 asanas. One may be forward bending, one backward bending, sideward bending, twisting. So these 3 to 5 asanas. Then one pranayam, whichever you like, do it to the most sincere approach with sincere approach, and then you can have a short reflection or relaxation technique, and this can be in the form of a swan meditation, SWAN, where the swan means S is self-estimation, of the strength what you have, then W stands for weaknesses, A for ambitions, what are my ambitions, and N for needs. So a great contemplation or thinking on all these lines definitely allows you to introspect, and it is the duality in the mind which is most of the times responsible for the stress and the release of the stress related hormones, raising your blood sugar levels. So a little bit of contemplation on everything definitely helps. So yoga, what we advocate, it should be understood as vidya and not as simple yogic practices, because that is definitely going to help you reduce your lipotoxicity, if at all, improve the cellular sensitivity to the cell membrane sensitivity to insulin. It will help reduce the inflammatory cytokines, decrease the deposition of amyloids, and lot of other biochemical benefits which we look at. And the Ashtanga Yoga, last line, what you need to follow is serve, love, give, be good, do good, purify, meditate, and realize. So look at yoga as art of healing, art of living, art of aging, and art of being. And I think that should be.
Thank you. Purnendu, being overweight is a deterrent to exercise on its own. So we start off with a trap of being overweight, needing to exercise, but now because I'm overweight, I can't move, and that's a problem, and one just enters a vicious cycle. How does one break this cycle?
So I think this is sort of what we tend to visualize when someone's overweight. They're just not moving. So we think like, oh my God, they're so big, so they can't move. So obviously it's not, right? It's, if you tell them, go down, get into your car and drive to Baskin Robbins, they will be able to walk and do that. So like I say to my kids, I ask them, what are you going to do if you have to eat an elephant? And how do you eat an elephant? It's basically one bite at a time. So if someone can get up and walk to the ice cream, well, I walk to the car to drive to the ice cream parlor, they can definitely walk to the car and come back instead of going to the ice cream parlor, and then walk to the car twice the next day. So start small, right? And this is with anything. It's not just about when you're overweight and trying to lose weight, but with anything. I have people say, I want to start reading again. I haven't read for a while. I'd say, okay, start, and they'll say, okay, I'll do 30 minutes tomorrow. I'll stop them there and I'll say, no, you will do only one page tomorrow. Then you might do one page the next day, and then maybe 2 pages the next day, or maybe after a month you'll do 2 pages. But if you just do 1 page every day, it's better than saying you do 30 minutes, and then day after tomorrow you won't do anything.
Right.
So, yeah.
Right. So I guess, as you mentioned, that 1% rule, just do 1% every day. Yeah. Aashish, coming over to you, and this is our last question. Many people these days use a personal trainer or a trainer at a gym. And firstly, does everyone need a trainer and supervision during exercise? And secondly, what should one be looking for in a trainer? Because is there a basic qualification that one has to be a trainer, or are we, how do we ensure that we are in safe hands?
Thanks, Sukhpreet. So to answer your first question, I don't think everyone has to have a trainer. It's a personal choice. Like I said, if you're doing nothing and you want to just start doing something, like Purnendu said, just walk to your car, or walk 5 minutes. Next week, walk 10. Next week, walk 15. You don't have to have a personal trainer to tell you that. But a personal trainer can also be a great motivator and someone who you're accountable to. I think human nature is such that you need to be accountable to someone, or you need to kind of report to someone, right? That's the way sort of lifestyle works. And I think a personal trainer can fulfill that role. So a personal trainer can be a great benefit to you, but I don't think one has to have one. To answer your second question, I think
I know.
today there is no definition of who's a personal trainer. Anyone can claim to be a personal trainer. It would be nice if they have a certification from a reputed organization. I know today, for example, Purnendu himself is certified by the American College of Sports Medicine. They've got various institutes across the country and across the world. So it'd be nice if your trainer was also certified. Just the same way you wouldn't go to a gynac who sort of learned just on the internet. you shouldn't go to a trainer who's just picked up off the internet, right? You need to have somebody who's well qualified, well trained, and experience also goes with it. So that's what I think.
Thanks.
Ashish, happy birthday, by the way.
Oh, thank you very much.
It's your birthday today. Happy birthday.
Thank you.
All right. So, and this brings us to the end. This brings us to the end of this healthy party session. Do we have any questions from?
Sukhpreet, there's a question. Please explain details of weight training exercise in children.
Tejal, I guess would you like to answer that?
So the age 2 upwards, we don't do any weight trainings. I don't think the age is specified in children. So above the age of 2 up to the age of 9, what we recommend is development of fundamental movement skills, right from balance, motor coordination, strength training, but only body weight training. And later on, after puberty, the child can start with weight training. So it totally depends upon what is the age of the child and what is the goal and the outcome that is needed in that particular age group. So then we can define the workouts.
Dr. Patel, do we have any other questions?
No, I don't think we have any other.
Okay, so I would like to thank